On the Medical Watch, a summer arrival for winter virus.
Medical reporter Dina Bair has more on the unusual timing and a warning for parents.
It's an illness that typically circulates during cold and flu season. Infants and young children are exposed to RSV, or respiratory syncytial virus, between October and March every year. Now a summertime threat. Doctors say COVID mitigations are a factor in the early outbreak. This time of year, it's typically playground injuries and a few broken bones that keep doctors busy inside Lurie Children's Hospital. But the pace is picking up for a different reason.
This week we've had about 20 cases of RSV. Only a few of those children have required the hospital, which is pretty typical, but we anticipate that those numbers are going to increase further.
Why such an early arrival for the virus not expected until later in the year?
Normally these viruses present in the wintertime, and those babies get immunity, and it goes away, and we don't see it again until the next fall. However, with the stay-at-home advisories, with the frequent masking, with schools being closed, all infectious illnesses in children essentially went down. And so now RSV essentially is catching up off-season.
Infectious disease specialist Dr. Larry Kosiolek says he's never seen anything like it. It's the same scenario at Advocate Children's Hospital, where RSV counts have spiked throughout the suburban system.
Usually the numbers are almost close to zero at this time of year, and they're higher than they have been yet in 2021. While RSV is spread the same way that COVID is, it's less contagious. So a lot of that masking and kind of social distancing was probably part of the reason why we didn't see much of it earlier in the year.
Infants and children 2 and younger are most commonly affected by RSV. What can look like a common cold at first can escalate. Symptoms range from cough, runny nose, and congestion to serious breathing problems, a sign a baby's small airways have filled with mucus.
With RSV, you can get mucus in your airways. When those airways are really, really small, like in babies under the age of 2, it can lead to wheezing and difficulty breathing, and sometimes even respiratory failure that requires an intensive care unit admission. And sometimes the breathing can be so rapid that it makes it very difficult for kids to eat and drink.
In those cases, call your doctor or go to the ER immediately. Milder symptoms should peak by day 4.
If the symptoms have been going on for 4 or 5 days and the child is actually relatively well, we're confident that child's not going to need the hospital. If it's day 1 or 2, particularly if that baby is really young, like under the age of 6 months, it's very possible that that child is going to worsen and that their illness is going to escalate over the next few days.
There may be an upside to the late surge.
So some of those babies, if they would have been exposed at 3 or 4 months of age in the wintertime, now that they're bigger, their lungs are better developed, their airways are bigger, they might have a more mild presentation of RSV now than they would have in the wintertime. If a lot of children happen to be exposed and get some immunity to RSV, it could make our winter season relatively mild, but we still have a lot to learn, and I will not be surprised either way, and predictions can be challenging during COVID.
Researchers are working on an RSV vaccine, and mRNA technology used for the COVID vaccine could help lead the way. Philadelphia and New York saw an RSV surge in March. Chicago's uptick surfacing over the last month. Back to you.